So before we close today, we have another topic. Avinash, increase in fees of dentistry and nurses uh, in the. Would you like to cover that?
Yeah, well, the government has decided to increase the fees of dentistry, and a lot of students are protesting. In fact, I think it's increased about 800%. It's come to 1 lakh a semester or more, and it's
833%.
833%, right? So it's quite unfortunate because one thing, dentistry is not like a medical, it's not like an MBBS where there is a shortage of doctors. There is kind of a oversupply of dentists right now, especially in the state of Goa.
Hmm.
To set up a dental clinic
Hmm.
is very costly. It requires lakhs of rupees of investment in terms of equipment. And now with COVID, they need like 3-4 lakhs of additional equipment just to make sure the place is sanitized, the spray does not spread. So anyone who's choosing this profession will have a tough time. Is anyways having a tough time
Hmm.
practicing. And at this time of COVID, they are increasing the fees. Reflects two things. One, the complete apathy uh, of the health minister and the CM in terms of that is his education minister. Is the complete apathy towards the people who, especially young youth who aspire to become dentists, towards the medical field in general. And second, it reflects the fact that the government is bankrupt, which is why they don't want to fund dentistry college. I mean, 10,000 job money for 10,000 job is
Hmm.
one thing, but you don't have the money to fund to fund these colleges. And recently, another
Hmm.
institution, nursing institution in North Goa,
Hmm.
changed the fees to charge
Hmm.
5 lakhs for the course. 5 lakhs for a nurse. We expect nurses, like especially men and especially youngsters from the remote areas, to come and do nursing so that they can provide that service in their villages. And if you're going to charge 5
Yes.
lakhs, it'll be too
Hmm.
expensive for them to work in the villages, and there won't be
Hmm.
any incentive for that. And second thing is,
Absolutely.
only a certain class of people will be able to afford to do that. So this is an
Hmm.
attack on the medical system. In any case, the fees for becoming a doctor, the MBBS course is too high. It should literally be free. Of course, you can always put a contract saying that they have to do service in Goa. Otherwise, if they're going out of Goa, you pay the
Yes.
fees, you pay whatever, and you go. But
Hmm.
if you're going to practice in Goa,
Hmm. Hmm.
you can give it at a very highly subsidized rate because health is absolutely important. Therefore, I mean, we
Absolutely.
all should support these students who, because this is something I faced in college, where while we are doing the course, the second
Hmm.
year, our fees were increased. From that time it was 15,000 to 35 or 40,000, and we all protested and we said
Hmm.
that, in any case, we can't afford it. We'll have to quit college. And then the government backtracked. The college backtracked. This is the same thing happening,
Hmm.
except
Hmm.
800% is huge, and it's unfair because every family plans for their child for that course. They plan the finances because next 3-4 years
Hmm.
are tough. They have to make a lot of sacrifices to fund that, and suddenly they are told, okay, now your fees are gone up. What do? They have wasted a year. They can't afford to pay higher fees, or they won't get loans on time to pay higher
Yes.
fees. So they'll end up in a debt
Hmm.
trap, and
Absolutely.
because of that, they will not be able to put their heart into service to providing the medical services that people need in the state.
No, absolutely. And this, as you were saying, is very apathetic because, first of all, the health system itself has been in shambles during the COVID pandemic. On
Yeah.
top of that, people have been losing jobs, or their salaries have been decreased from their original amount. There's a lot of uh, turmoil going on within our society because people don't have enough money in hand, and then to have such a huge jump in fees of 833%
Absolutely.
is is unthinkable. Like, if I put myself in the shoes of Vishvajeet Rane, and I would be like, how can I ever get this past people? Like, how is it going to make people feel?
He doesn't live in
That's
our reality. Obviously, they don't live in our reality. That's why they can do whatever they want. They can promise whatever they want. So Uh, but that's what I mean. There is no improvement in the facilities by this thing by the college. There's no increase in any sort of loans which the students can later take to set up their own clinics in the most remote part of Goa. But yet, they had the audacity to increase it in between their course, in between the term, and that's absolutely wrong because it's a contract. It's not it's education. Higher education is not like school. It's a contract between a customer and a service provider. The service provider promises that they will provide a service to you, that is the education skills, for a amount of fees, and in between that, when you are most vulnerable, when the customer is most vulnerable, it's like going to a barber and you agree for a price, and while he cuts half your hair and he says, no, now I'm to increase my prices, so either you give me or you can walk out with that. It's like that. It's an unfair deal. It's an unfair contract where one person is at a disadvantage, and you cannot hold people hostage like that. You cannot hold these students hostage. So I hope this decision is backtracked and they don't increase it even in the future for future generations as well. Especially now when families, their income is down, their savings have been, declining. The next few
Yes.
generations cannot be, you cannot give them this kind of burden at all.